Because Washington University has been the site of many clinical trials, we were excited about the approval of Lecanemab, and we had been working really for years to set up the infrastructure to provide it to our patients. And within a month or two of the approval of Lecanemab, we had multiple patients that were already receiving infusions, and we now have 200 patients receiving Lecanemab infusions at our clinic. I know that at other centers, the uptake has been slower, I think because they maybe did not have as much experience with these treatments or the infrastructure kind of set up in advance. In terms of our experience overall, it's been a lot of work. Providing these treatments to patients really requires extra effort in terms of the evaluation. So we need to do biomarker testing. We have to have a recent high-resolution MRI scan to verify that there's not significant evidence of microhemorrhages or superficial siderosis that would put them at risk for ARIA. We have to do ApoE genotyping and return the results, which we never did routinely before. We have to have a very detailed discussion about the risks and benefits of treatment. Again, that's not something that we had been doing before. So this has really required a lot of extra work, a lot of extra discussions with patients. We've had to hire additional staff to help with this. Also, just the infrastructure for managing all of the schedules for infusions and MRIs and return of results and follow-up visits has been a lot of work to set up. But I would say that all of us feel quite committed to this. There has been a lot of concern about the anti-amyloid treatments generally with regards to ARIA. And we have actually found that the rates of ARIA were as expected based on the clinical trial. And we've had 30 patients who have had some degree of ARIA out of, I think it was 154 patients who had received their first 4 infusions in brain MRI. And nearly all of these patients were asymptomatic or had mild ARIA symptoms. Actually, we only had, I think, 7 patients who had symptomatic ARIA, and most of those symptoms were quite mild. We've had 2 cases that were in the moderate to severe category, and those were patients that we had to hospitalize. And of course, that's concerning, but in general, we found that these patients still recover and have a good prognosis over time. So it's been a lot of work to set up the system to provide these treatments, but overall, we feel like we've gotten it to work. Our patients have really appreciated us providing the treatments to them and being willing to talk through the risks and benefits. And we plan to continue providing these treatments to patients in the future.